Okay. Hi, everyone. Karen Hawley back from Women's Abundance and KH Essentials. And I'm really excited because today I have not just one, but two amazing guests with me, Stephanie Prendergast and Karah Charette. And Stephanie and I have known each other, I want to say, for several years now. Stephanie spoke at the second Women's Health panel here in the Bay Area in Berkeley, California. And she is the co-founder of the Pelvic Health Rehabilitation Center, which, believe it or not, is coming on 15 years. I think next year it will be 15 years. And it is the largest. It has grown from its first office in San Francisco to all over California. We're lucky in the Bay Area because it's Walnut Creek, Berkeley, Los Gatos, but down in LA, West LA, and then she's even moved to the East Coast in Massachusetts. And right now, the Pelvic Health Rehabilitation Center represents the largest multi-center clinic in America that actually solely focuses on the pelvic floor. So I'm super excited today because you have two amazing experts in pelvic health. And Stephanie, I wonder if you could share with the audience kind of what got you into pelvic health and why you started PHRC.
Thanks, and thanks for having me. It's always great to be here. I'm happy to be here with Karah too. So a few years ago, meaning 20, when I graduated from physical therapy school, I just really wasn't excited about knees and ankles and shoulders. It really wasn't very interesting to me. And I thought I had made a mistake by going to physical therapy school. I was looking into other options, and I happened to come across a job ad in a newspaper, because this was in 2000, that said pelvic floor PT wanted, will train. So I kept calling the office, and they weren't answering. And finally, I got myself an interview. And that's when I learned about pelvic floor disorders. I saw that patients couldn't sit down, they couldn't have sex. They were my age, and it was just a whole field I didn't even know existed. And that was much more interesting and meaningful to me because of the level of disability that I saw and knowing how much pelvic floor PT could make a difference. So I started working in a clinic with a urologist, which really granted me the opportunity to learn more about the medical side of things, and I think physical therapists often get exposed to. And it was an interesting place because I only saw pelvic pain. So when you only see the same diagnoses all day long and you're working with a physician, the learning curve was pretty steep. And so I felt like we learned a lot quickly. And I know that's not the experience that many PTs have. And as time went on, my business partner, Liz Akanjalar, and I, who were working together at the urology office, had more ideas in mind. We wanted to teach and lecture, and you can't necessarily always do those things as an employee. So we founded the Pelvic Health and Rehab Center in 2006. And now here we are with our 9 clinics, and we're teaching and doing all the things we wanted to do. So it's been wonderful.
Yeah, it's so exciting. And for those of you who don't know, Stephanie also was very actively engaged, even the president of the International Pelvic Pain Society, and also sits and has served on the World Congress of Abdominal and Pelvic Pain. So anyway, you guys are all lucky because we got a serious expert here, and Karah as well. And Karah, you just recently joined PHRC, right? Do you want to talk a little bit about when you joined and what brought you to pelvic health?
Sure. Yeah, it's actually coming up almost my 1-year anniversary. I moved to California in late October of last year, and kind of a similar experience. In PT school, I was very late in PT school where I was exposed to pelvic health and realized this is really the part of the body I'm very passionate about, and realizing how even as a PT I still didn't know about this, and that there's still so much work to be done to really advocate for health for this part of the body. And I actually moved back home for a year after PT school to get more skills, to take continuing education courses, and actually stumbled across PHRC through social media because they have a great social media platform, saw that they were hiring. At that point in my life, I knew this is what I wanted to specialize in, and this clinic was clearly one of the expert clinics in the country. And then I was lucky enough to get the job, and it landed me here, and I've been learning a lot ever since. It's been a great experience so far.
All right. Well, welcome to you both. And I thought what we would start off with, Stephanie, when you and I were speaking a few weeks ago again, we both, well, you know, because you have clients all the time coming in, but we both realized that a lot of women don't understand the deep interconnectedness or the relationship between the pelvic floor muscles and tendons and their hips, their legs, their abdominals. So I thought we could start with you showing the audience a little bit more about that interconnectedness.
Yeah. And while we're pelvic floor physical therapists, we're still physical therapists first, which means that we are addressing the whole body, but we just have additional skills in understanding the pelvic floor. And I know a lot of us talk about this a lot. I have no idea how things became so separate, because the pelvic floor is in the middle of everything. And as we're going to get into, people who have back and hip and other issues, even that don't appear to be pelvic floor in nature, the pelvic floor is always involved. So we can start by looking at the muscles. I have my little model here. And so the bony pelvis model, this is what we call the pelvic girdle, which is basically your pelvis. And then the pelvic floor muscles run from the pubic bone back to your tailbone. They support our organs, which you can see inside here. And they are also responsible for urinary and bowel function. In men, they're responsible for erections. And in both sexes, it's what causes an orgasm. And so these muscles have a lot going on. But what makes them unique is that they also have innervation unlike any other part of the body. So we have sensory and motor fibers, meaning we can feel things and move things in all of our other peripheral muscles. But when it comes to our pelvic floor, and I can show this muscle here, they're also under involuntary control because they have autonomic nervous system components to it. So that means this is your vagina, this is your anus. As PTs, we can examine these muscles, but without us thinking about them, they're active all the time. They keep us from leaking urine and stool at inappropriate times. But we also have the ability to override that autonomic feature. For example, every time you decide, okay, it's okay for me to urinate right now, your brain tells your pelvic floor to relax. But all the rest of the time when you're walking around, you don't have to think, oh, I need to hold my urine, because that's automatically just happening. So it's a really unique part of the body because it has all of these different features to it that other muscles don't have. And it's involved in everything we do. And so in addition to the urinary, bowel, sexual function, I mean, obviously this is affected by childbirth, and the pelvic floor is part of our core. So our pelvic floor actually works with our intra-abdominal muscles, the deep core that we think of, and also the pelvic girdle. All those muscles that attach to the bony pelvis are also, they have an influence on the pelvic floor, and the pelvic floor has an influence on them. And most people don't even think about these things until things start to go wrong. I mean, why would you? Is that a good overview?
Yeah, no, I love the model. And I know that it's going into one of the things that we wanted to talk about today, which is, I'll go into it before we talk about why women at 40 should have an evaluation. But no, maybe we'll save it for the demo. In a little bit, you guys, she's going to show you how sometimes exercises, if done the wrong way, can actually impact those muscles negatively and what can cause some of those problems. So before we go into that and do the demos with Karah, I know Stephanie and even many of the women who have written into Women's Abundance, they say, why should a woman in her 40s go have a pelvic floor eval? Like, what is it that drives what? I know women in Europe and women in Asia, it's much more common right after they give birth to immediately go to a pelvic floor specialist, but we don't do that here. And it's gaining momentum through organizations and like yours, and certainly the worldwide conferences. But why do you think every woman who's entering her early 40s should just make it a point to go have an evaluation?
So this is a great topic because in the last few years, we have seen a movement about the postpartum care. It was not until 2018 where the American College of Obstetrics and Gynecology actually acknowledged the fourth trimester in the United States. Like, it is not a secret that we have the worst maternal care in any progressive country in the world. which is really, really upsetting. But at least they acknowledged that, think about birth. Anybody can think about birth and understand that that is going to do a number on all of these muscles, even pregnancy, and regardless of the method of delivery. So there is a movement towards, in the postpartum period, trying to get women to have pelvic floor physical therapy in America when that's given to them everywhere else. But another phrase has started circulating recently that I'm really excited to see, which is postpartum is forever. So once you have been through pregnancy and once you have been through birth, even if you think you're normal, there has been consequences to the pelvic floor. You pair that with the age-related changes that happen starting in perimenopause, which for many women is at the age of 35, where our hormones start declining. And again, you may not notice it, you may not have symptoms, even though a lot of women do. They do leak, they do have prolapse, they do have back pain and hip pain. But we start to go through these normal age-related consequence changes, and our pelvic floor has estrogen receptors. So does our vulva. And so when our hormones start to decline, we normally weaken over time if we're not paying specific attention to ourselves. And there's really a good opportunity for women to, just like you go to your personal trainer, just like you take care of other parts of your body, to see a pelvic floor physical therapist and learn how to optimize your pelvic floor muscles and make sure that you're not doing things in your day-to-day life that actually could be compromising them. If I can share a little story about myself, about something that happened recently, I can give you a good example. COVID hit, as we all know, we're all dealing with COVID stuff, and I completely stopped exercising maybe for the first time in my adult life. It just was not something that was fitting into my day with all that was going on. When I started again, we also happened to be training a new employee. When we train new employees, they practice on us before they get let loose in the clinic. And what happened for me is and Karah's going to get into this, when we contract our abdominal muscles, our pelvic floor muscles should contract with it. And when I stopped exercising and was trying to teach somebody that I was training how that coordination works, I myself couldn't do it. I have 20 years of experience as a physical therapist. When I exhaled and tightened my abdominal wall, I was pushing on my pelvic floor, which can lead to further weakening, prolapse, and other symptoms. And it took me, I'd say, a good 2 to 3 weeks with the help of somebody on my staff that was already trained to get my coordination back. And that's me, who knows what I'm talking about. So I think many women may not be aware of what's actually happening with their pelvic floor when they exercise. And sometimes we need a little help. Sometimes we don't. And sometimes things work as they should. But it was an eye-opening experience for me. And it really made me think that, especially as we're trying to be more proactive about women's health in the last few years, this is really something everyone should do.
Yeah, I totally agree, Stephanie. I remember post my surgery that's how I was introduced to Stephanie's office. But I also have worked with both Stephanie and Karah, and I was shocked at how my stomach muscle routine was actually negatively impacting you'll have to tell me the exact teeny tiny muscles down in the inside of my vagina that you were working on, but they were so tight. And Karah and Stephanie both said, oh my gosh, the reason why you are in so much pain is on the outside of my inner right leg is because my muscles were so tight. They hadn't relaxed. So they were like in this fight or flight because they had just hardened up tight. And so a lot of women don't realize that they actually need the physical therapy to help relax those muscles, especially after surgeries, or because that's a trauma, right? And so the muscles react to the trauma, or childbirth, I would imagine, is the same. So yeah, thanks for sharing that story. So if a woman were to make an appointment, would she just say, hey, I want a regular evaluation? What would she do?
I think the right thing to say is I'm entering perimenopause and I would like to know how my pelvic floor muscles are functioning. I'd like to be screened for pelvic organ prolapse. And most people who have had a baby do leak urine when they cough, sneeze, laugh, but because everybody does it, it's been normalized. And just because it's common, this is not normal. And that is a sign that there is something wrong. And again, a study came out recently, 97% of women who had back pain also had pelvic floor dysfunction, but they're off in their orthopedic clinics and not being checked for pelvic floor dysfunction. And so when we see people not progressing and not hitting their goals, this really could be the missing piece. And I think many women can relate to that and will really have that aha moment during the eval. That's, I think, and I think Karah can speak to this too. It's one of the best parts of our job when they're like, oh my gosh, I had no idea. And you can fix it. And Karah brings an additional skill to us too, because she comes in with Pilates and yoga certification. And I think the combination of her experience as a pelvic floor PT and this additional training also can really help people in a way that just your standard practices can't do, understandably.
Mm-hmm. Karah, do you have I know this is out of the blue, but a client that you've worked with lately where it was an aha moment, like Stephanie was talking about, where a simple exercise that you taught her or shared with her, just awareness that actually changed her life? Do you have any examples that you'd like to share? And you're on mute, by the way.
Yeah, I mean, I actually was just working with a woman a couple weeks ago. This is like the pretty classic postpartum, was told she has prolapse. And honestly, the aha moment for her was even just knowing that what we've been talking about, that exercises can actually be harmful to your prolapse if you're not doing them correctly. No one educated her that going and doing sit-ups, she had heard, oh, doing core work will help me postpartum, but she was doing sit-ups where she was holding her breath. That pressure is pushing down. She didn't know how to coordinate her pelvic floor. It was a really awesome moment for me to just be able to say, hey, we can actually change this pretty quickly with a little bit of education, getting her that right coordination. She immediately started feeling better and more confident and safer in her body. And so that was a cool moment of just education alone really changing her life. And then, we're on that journey to make her pelvic floor stronger from here on out. I think you're muted, Karen. Can't hear you.
Oh, thank you. Thank you. Thanks for sharing that story, Karah. So a question to both of you. Stephanie, you mentioned the statistics on back pain, which the new survey came out about. What are the other areas of the bodies, I know we spoke about last week, other parts of the body that are common that you guys see come in for pain, and then you realize it's a pelvic floor issue, but they don't realize? So like hip, what else?
Hips are common. And again, if there's sex should never be painful, but it is for a lot of women. In fact, 1 in 3 have painful sex in premenopausal women. And then of course we have to deal with the genitourinary symptoms of menopause as well. Maybe symptoms start out kind of benign, so maybe a little discomfort with intercourse, which can then progress into a full-blown unprovoked vulvar pain situation. Other things that people are like, I just have a weak bladder. Maybe they urinate, and the number is 6 to 8 times in a 24-hour period is considered normal. If someone's going to the bathroom 15 times a day, it may not necessarily be bothersome to them. They think they have a weak bladder, but that could be a sign of pelvic floor dysfunction. As women age and their orgasms start to diminish or change, a lot of times it just gets attributed to the estrogen loss. That's not true. It's muscle weakness and muscle changes. People may start to have to strain to have bowel movements or feel like they have incomplete emptying. And again, it can all be related to pelvic floor muscle issues. These muscles have so many overlapping symptoms with urinary tract infections, yeast infections, bowel bladder issues. There's just so much that goes in that I feel like we're uniquely positioned as physical therapists to evaluate those muscles, but also understand the rest of it. Whereas all of my friends who are urologists, gynecologists in that space, they push right through these muscles with their speculum or the cystoscope. They don't look, they don't know how to assess them. And that's kind of mind-blowing to me here in 2020. It takes less than 60 seconds. And I've published articles on how to do pelvic floor exams. I mean, I could teach you how to do it this afternoon, but we won't. But it's not that hard. So we could teach women how to do that themselves too, which I know Karah is going to really get into with us. Yeah.
Yeah. Yeah, and I loved, Dr. Sherry Ross down in Southern California. When I met with her a couple weeks ago, she said that, and she's an OB, for those of you who've not watched that interview, also was fantastic. And it's how I met hers, through Stephanie. And she said that she 100% relies on physical therapists to work with her OBGYN patients, because that's not what her focus is. And she needs to collaborate and coordinate with PT folks to actually help women navigate and repair their pelvic floors. So, yeah, so thank you. Okay, so moving on to what are 3 to 5 things that you would recommend that women could do easily to first protect their pelvic floor, so the younger women out there that we're also trying to reach through Women's Abundance. And then, a lot of women have contacted me after they've had 2 kids and said, oh my God, is it too late? How can I repair my pelvic floor? What is this prolapse going to be plaguing me forever? So I know that's a lot, but I know Karah wants to do some demonstrations too, but however you guys want to handle those questions.
Yeah, go ahead, Karah, take it away.
Oops,
You're muted right now. Unmute.
So would you like me to go into my demonstration now? Or
sure. Yeah, go ahead.
Yeah. So I think one of the most important things that we need to understand when it comes to our pelvic floor is that we need to be able to both contract and relax these muscles. And I think that's one of the trickiest things. A lot of the discussion out now is, to have a good pelvic floor, I need to Kegel, is often what it's known as, or do a pelvic floor contraction. Now, a pelvic floor exam is often the best way to know what state your pelvic floor muscles are in. Are they too tight? Are they weak? Is it both? But I want to provide a few exercises where people can start to understand how to connect to this part of the body and see if we can play with both relaxing and contracting to know the difference. And so what I'd like to start by demonstrating is actually just in sitting. We're all sitting right now. We want to start by actually using our breath to connect to the pelvic floor and understand how to get that pelvic floor to relax. I think this is one of the most important things to understand. And so I'm going to have everybody go ahead and bring their hands to their rib cage if you guys want to join along. And we're just going to have our hands on our rib cage here. And if you want to close the eyes, that's fine. I'm going to have you take a nice deep breath in, and I want you to feel that rib cage expanding out to either side. So take a nice deep breath and see if you can send your breath into your rib cage, and then just exhaling passively, let that go. And you might be wondering, why are we breathing into the rib cage? So continuing to breathe like this, I'm going to explain why. When we breathe into the rib cage, there's a muscle underneath the rib cage called the diaphragm. And this is a respiratory muscle. It kind of looks like an upside down U. And when we're able to breathe into that muscle effectively by breathing into our rib cage, it kind of pulls that muscle, it lengthens it and allows it to drop down. And that happens on the inhale to create space for air to come in. This is important because that diaphragm is kind of the roof to a system, and the pelvic floor is the floor of that system. So these two areas, they like to copy each other and they like to move together. So if we can get that diaphragm to effectively lengthen and drop when we take a deep breath in, our pelvic floor is more likely to do the same thing. So again, with that understanding, go ahead and take that deep breath in. See if you can imagine that diaphragm lengthening and dropping down. And then if you can bring the visualization to the model that Stephanie showed earlier of the shape of those pelvic floor muscles, that bowl, can you imagine when you breathe in that that bowl is also lengthening and expanding? And this is where I'll often bring in the idea of like a balloon. If you had a whole system of a balloon that was expanding with air, getting this 360-degree expansion, the base of the balloon would expand and drop down, and that's essentially what your pelvic floor is doing. Now, this definitely takes practice, and you might be feeling like you don't feel much right now, and that's okay. What we're going to try to do is also now go into a contraction. And sometimes with the contraction, we'll feel the pelvic floor drop after, and that can be an effective way to feel that as well. So let's start to come back into that breathing, the diaphragmatic breathing. We're going to take a nice deep breath in, feel the expansion. Now this time, as you exhale, blow out through pursed lips like you're blowing through a straw, nice and forcefully. And imagine your pelvic floor muscles are coming together and lifting up like an old-fashioned elevator car, one of those old ones that moves really slowly up a building. And then when you feel like you can't go any further, just let that go. We're going to try that again. So again, that's an inhale into the rib cage. And then as you exhale, blow out through pursed lips and think slow. These muscles don't like to turn on quickly. Can you imagine the vagina or the anus actually drawing up towards your belly button? And then again, you can let that drop with the inhale. So this is a great opportunity to combine the two ideas. You use the inhale to feel the pelvic floor relax, and then you use that exhale to feel the pelvic floor come up. If you're not feeling movement, this is where, again, it can take practice, but where a pelvic floor exam could be really helpful, because oftentimes our muscles can be either just weak or they can be so tight that they're weak and we can't feel that mobilization of the tissue. So I want to offer two more positions if it's okay for me to keep going, because I know sometimes in sitting it's also difficult. We're also working against gravity, and sometimes it's hard to feel those pelvic floor muscles actually lifting. So what we're going to try going along with the pelvic floor contraction is we're going to try to use gravity in our favor. So if you're able to, I'm going to demonstrate by coming onto my back. And we're going to try this in a bridge pose. So if you're able to get on the floor, we're going to come into what is known as a neutral spine. So you're going to come with your back on the ground, your knees are bent. You've just got a little breath of air under your low back. And you've probably seen a bridge before, maybe in Pilates or yoga, where you lift the hips. So we're going to just come into a mild bridge as long as it doesn't irritate your back. We're going to use our breath here. So taking a nice deep breath in, as you exhale, you can blow out. You're going to push through the heels and start to lift the hips. And then while we're here, we're now going to try to actively Kegel. So keeping a level pelvis, you're going to take that deep inhale. You can bring your hands to your rib cage again. You inhale. And then as you exhale, blow out through pursed lips. And imagine those pelvic floor muscles zipping up, coming up towards the belly button. You can almost imagine them on a slide, kind of sliding down towards your head. Gravity is going to help those muscles come up. And then as you inhale, see if you can let them relax and see if you notice a difference. And we'll just try that one more time in this position, inhaling. And then as you exhale, blow out through pursed lips. Feel the pelvic floor muscles knitting in, whatever image helps you, that elevator. And then again, inhaling, you just let that go. And then I'm going to slowly lower one vertebrae at a time, mindfully coming down. So this is a great position to try if you want to get a little bit more of a sensation of the muscles lifting with gravity. And then going back earlier to the relaxation, if you're still like, I didn't feel my muscles relax, I really want to feel that. Another thing we can do to help kind of trick those muscles is to bring the pelvic floor into a stretch. And often that will allow the muscles to relax more effectively. One of the best stretches for the pelvic floor is actually child's pose, which again, maybe you've seen with yoga. So to get into child's pose, you're going to come onto all fours. And then we want to bring the toes together and the knees out wide. So you want the knees wide because we want to actually open the hips in order to get the pelvic floor to stretch. If when you're coming into this position, your hips can't touch your feet, you can take a big pillow or a bolster and stick it underneath that area. You want to support your body so everything can relax. Once you're able to lower the hips down, you're going to walk your hands out long and let the forehead relax down. And then in this position of child's pose, what I want you to imagine is coming back to that rib cage breath, but think about breathing again in now to the back side of your rib cage. It's going to be a little more difficult to breathe into the belly because your belly is a little bit occluded by your thighs. So think about breathing into that back side of your rib cage. And then again, if you're able to, you want to drop that image down now to the base of your pelvis. And if you can go back into your mind of that picture of the model Stephanie showed earlier, you might remember there were two bony landmarks at the pelvic floor. We call them our sits bones. And if you can, and Stephanie's even showing it on the camera if you want to look. So those two white parts, those sits bones, if you can imagine in child's pose as you inhale, that those sits bones are gently separating, and then exhale, gently soften. That's going to allow you to feel a little bit more of the breath connection to expand the pelvic floor muscles when you inhale. And then when you exhale, it's just passive. So we're not going to actively contract right now. We're just trying to relax the pelvic floor. So using those visuals can be really helpful. Again, now if child's pose doesn't feel great as you come out, you can also take a pose called happy baby in yoga, and this is on your back, and I can demonstrate it really quickly. When you're on your back, you draw your knees into your chest, and then you can either just grab your inner ankles, but if you have more flexibility, you can grab your inner arches of your feet. And it's the same idea as child's pose, where we want to open the hips. So you open your feet wide as your knees drive down towards your armpits. This position is another great pose for someone who maybe doesn't want pressure on the knees, has a little bit less flexibility, and always use props. If something doesn't feel great, you can put a bolster under your hips. You can put your legs up against a wall. When we try to relax the pelvic floor, we want to make sure the whole body can relax. Otherwise, tension in other muscles will make it more difficult. So that's my quick little demonstration on some ways to start to connect with your pelvic floor. But as always, if you're not feeling connections and you're not sure what's going on, the exam is the best way to really understand where your muscles are at and to get one-on-one feedback to really understand how to use your muscles the correct way in your body.
Karah, that was fantastic. Thank you so much. And
You're
because
welcome.
we're probably on IG, it'll be speaker view. If Stephanie can then hold up that thing one more time, Stephanie, and speak to the muscles, I'll go on mute so that it goes to you. Say something.
Okay, so as Karah was just demonstrating, these are our sit bones here. So imagine yourself lying on your back. Here we are looking at the pelvic floor, and especially in child's pose, as you can see, these muscles do not cross a joint. And so we've got to kind of get creative with the way we move them. As Karah just pointed out, the breath moves the pelvic floor. When we inhale, the muscles come down, sit bones would widen a little bit. As we exhale, everything kind of comes back together. When you get into the child's pose with the hip flexion, your body weight comes through the pelvic floor. It allows a little bit of separation of the sit bones and then will help you get a better range of motion, if you will, in the pelvic floor compared to, for example, if we're sitting or standing. And we would encourage people to try to move their pelvic floors when you're standing, when you're sitting. Lying down on your back is actually one of the hardest ways, at least for me, especially with the coordination issues that I went through. And child's pose is one of the easiest. And so that way you can really feel things move and see if you can notice what's happening with your breath, and then also your ability to override it by trying to actively contract or gently push.
Thanks, Stephanie. So Stephanie and Karah, for those demos that you did, the exercises, child's pose, happy baby, and then the modified bridge, does that also help women who might have pelvic prolapse to heal that?
Yeah, so the bridge pose is one of my favorites to give for people with prolapse, because one of the biggest complaints we get with prolapse is this feeling of heaviness, because gravity is going to pull things down until we really increase tone and strength at the pelvic floor muscles. So not only is that bridge pose helping you to feel more activation in the pelvic floor, it's actually using gravity to help allow those organs that are falling a little bit to come back to a more normalized position. And then I think something I really work hard to drill home with my prolapse patients is the idea that a tight muscle is not a strong muscle. And so that's the argument, to make sure you are relaxing your muscles. You theoretically would never just work your hamstrings or just work your biceps and then just leave them in a shortened position. You want muscles to lengthen. You want them to have a good stretch after they've worked, because there's a thing called length tension relationship. Muscles generate better force when they're able to have good length. And so this is a really important concept, because women are often taught Kegel, Kegel, Kegel. You're not going to generate the most force and have the best strength if you can't also fully relax. So all of the ones I showed with child's pose, happy baby, are going to be really good for helping with that concept.
I remember when you were telling me that, how tight I was after my surgeries. It was horrible, horrible. So yeah, super helpful. Okay, so any other tips or tools that you all want to share? I know, Karah, we've talked about sometimes your office uses cupping. I know from my 8 years in Asia, oftentimes women think of cupping as like getting toxins out, but there are ways in which you guys use cupping to increase the blood flow. So do you want to talk a little bit about cupping that you sometimes do?
Sure. Yeah, I really like to use cupping because beyond what you just described for the benefits, it does increase blood flow. We also use cupping in the clinic to break through fascial restrictions. And fascia is that connective tissue that wraps around muscles. And when that gets really tight, it can be another reason why we don't get good blood flow, good oxygen to muscles, making them weaker or even painful. And so I actually really like to use cupping in particular on the glutes, which is an area that can get really tight with pelvic floor dysfunction, and releasing that tissue. Cupping can be very effective, as well as I think with you, Karen, we were even trying to do some gentle cupping on your inner thighs because inner thighs are connected to pelvic floor dysfunction as well. And I think cupping is a great way to be independent at home. If you can't get into the clinic or you want ways to maintain the manual work we'll do in the clinic at home, the cups you just showed are those silicone cups. They're very gentle, very easy to use, and then you can use that at home on your body, not just statically, but what we do in the clinic is also move the cups dynamically. And so you always, if you're doing this at home, you want to go light, you want to make sure you use lotion, but that's how we start to break through some of those fascial restrictions.
Yeah, and you guys, they literally with the lotion, it'll slide and it keeps the suction, it keeps the suction cup as you slide, and you can see there's different sizes depending on where they're used. But super, and oh, there's even a teeny tiny one. I think it's for by eyes and stuff. But the other tool that I know you guys have talked about for women in reaching places that they can't reach is the Interrosa wand. Do you want to talk about how that is used or what you use that for?
Yeah, I can talk about that a little bit. So I will also often give the wand as a tool for women who want to be independent. I don't recommend going into using the wand without consulting with a physical therapist first, because there are areas in the pelvic floor you want to be aware of to avoid, so that we're not just hitting certain nerves and things like that. But the wand is a great tool for people who do get a lot of relief from trigger point release work in the pelvic floor when we're actually getting on tight muscles and allowing them to release. And some people will use things like dilators, which are more straight. The wand is really helpful because it has this S-shaped curve. It basically replicates the curve we can make with our finger when we're getting on different muscles in the pelvic floor. So again, recommended to at least learn how to use with a PT once or twice before using independently, but can be a great tool for releasing tight muscles.
Thank you. And yeah, I would have to say, after having experienced PT and then trying to do it on my own, it is much, I feel like there's much more benefit in an office, but I know with COVID and everything, you know, we all have to get that instruction and get more creative. But like you said, having the advice of how to use this first is a huge help, because someone could easily misuse it. So let's see what else. I think, Stephanie, wasn't there one other thing that you wanted another device that you recently uh, um, purchased from Amazon, so that and I guess it really relates to COVID and how I know you all are launching a whole new digital program, and you do have office hours, and you know, based on all the new COVID rules and stuff, but you had talked about something that could help women at home. Do you want to show them that?
Yes, we have had to get creative during COVID times. And so while all of our clinics are open, we did launch a digital program for people who maybe don't feel comfortable leaving the house, or what it's turned out to be is just people who want to talk to us, like literally from around the world. One thing, in addition to pelvic floor muscle health, that I feel very strongly about is also having women do skin inspections on themselves and look at their vulva. And one of our newest team members showed me this device. Again, we're all learning from each other, which is really a benefit of a company our size. Is there's this little LED light that you can buy on Amazon for $11, and it basically extends, as you can see, and it has a mirror on it that swivels. So a lot of times women have a hard time looking at their vulvar tissues. It has a little light on it so you can nicely see what's going on. But more often than not, when we're treating people, and if there is some sort of hormonal situation that's going on, they don't know where to put the topicals that they've been prescribed. And we see this happen where the areas that they're putting the topical on is starting to heal, but you see this whole other area where they miss. And a lot of women don't realize where the clitoris is, where the urethra is, where the opening of the vagina is, or even what's the vestibule, which is really important. So if you go to our YouTube channel, we recently did just publish a video on how to examine your vulva, which can go into more detail than I can here. But I did bring a picture for people to see. And in this picture, you can see on the one side, everything is very red and angry. That area that you can see that is red is what's called the vestibule. That is distal to the opening of the vagina, and it surrounds the urethra, which is right at the top and below the clitoris. On this picture, you can see a healthy vulva, which has been through topical hormones and pelvic floor PT. We got rid of the red, and now it looks healthy and pink. But women should really start to examine themselves just like they do their breast exams, so they know what their normal is if things start to be abnormal. And so you need to know where the urethra is. That's more often the place that women miss when they're applying the topical. They don't realize that that vestibule goes around their urethra. And when we start to have hormonal compromise, whether it's from birth control pills, perimenopause, or breastfeeding, you start to get an angry urethra, you think you've got a UTI, it could really be a hormonal insufficiency combined with muscle dysfunction that's also by the urethra. So the vulvar dysfunction and the pelvic floor muscles go hand in hand because they're right underneath of it. And the skin inspection is just as important as the muscle. Just like postpartum is forever, so is menopause. And we have to deal with the hormonal insufficiencies, especially because women are now living to an average age of 82, and menopause starts in the 50s, and perimenopause starts in the 30s. So there's a lot of things that women can do to keep this area healthy, but it's still astounding to me how much confusion there is surrounding this amongst my friends, amongst my parents, my aunts. It's just, one of my aunts saw one of our YouTube videos and like they had no idea. And I'm like, you're my relative, you can't not know. But it's not like I bring it up all the time, like, hey, how's your vulva? So I really think things like what you're doing and the campaign that you're on is really doing so much to help women. So thank you for your crusade, because it's really is easy.
It's totally my pleasure. It's people like you that inspire me. So Stephanie and Karah, I mean, you know, I only came on this journey because of my ovarian cancer and being thrown into menopause so abruptly, and just realized, oh my God, this is an area of women's health that is underserved. Certainly pelvic health, and then perimenopause and menopause in general as well. And I love that you brought up the topical hormones and how they actually can impact the urethra. I remember you talking at the Women's Health Panel a couple of years ago, and also around women not knowing that testosterone can actually help. There's topical testosterones that can be used in the vulva and vagina area to, I think it's even to help with UTIs, right? Sometimes.
Correct. So, and I'm glad you brought that up, because as you have been through yourself, like sometimes hormones are not appropriate for people based on cancer risk and whatnot. But there is an entire group of misinformation that still is circulating about the safety of hormones. And many women don't realize that we do have testosterone and we do need it. When I showed the picture of the angry vulva, that person had in her lab work no circulating free testosterone. Our vulva and the vestibule have androgen receptors, meaning they need testosterone and they need estrogen. And that's really important for the health of those tissues. And people don't realize how much that can affect, again, the urethra and the vagina and painful sex. And so we really do encourage people to work with a menopause expert for the medical side of things, not necessarily your OBGYN who delivered your children 20 years ago. From my clinical experience, there is a wide range of information amongst physicians, and they physically cannot know everything. And so when you are trying to deal with these issues, you want to see somebody who has a special interest in this, because it takes hours and hours of continuing education to be able to understand how to safely help women through menopause. And sometimes if they don't have that, it may just be like, oh, here's a topical that maybe only has estrogen in it, or, oh my gosh, no, it's going to give you cancer. It's just not true. So we recommend the North American Menopause Society as the go-to. And women can educate themselves, but they need to know where to go for the reliable information. So that society is the gold standard. And again, just keep in mind, menopause is a whole separate specialty within OB/GYN, which I don't think OB and GYN should be together. There's just too much to know. It's a lot.
Right, right. Well, I mean, you've heard me say this many times, Stephanie, and I remember when I was interviewing Taylor's, the CEO of the Cusp, because they are a niche organization here in the Bay Area that started, and they specialize in menopause and perimenopause, and they have functional experts as well as naturopaths, and then they've got their Western medicine as well, which is fantastic because most OBs don't get that in school. They have to elect for it. They have to get NAMS certified, which is, again, for the audience, Stephanie stated, North American Menopause Society, and you can Google that. They have a plethora of information. They have books, they have downloadables. They also have a site that you can search for doctors in your area. So yeah, I remember thinking that my OB knew everything. I was like, I have a woman's problem. You know everything, right? And they're like, no. And the hard thing is I think some OBs try to be that for their women clients, and then they send them down the wrong path. Like I
Yes.
definitely can say I had an OB in my life that was like, oh, just do this. And it wasn't the right thing to do, and it was only later in life that I realized, oh, I really should be speaking. I really need to think about what kind of doctor to hire, right? Because we're our own best health advocates. And that's a big part of why I do this, is to encourage women to take control of their health, educate themselves, and make sure that they're getting the right care and that they're comfortable with the care they're getting. So my gosh, what an incredible journey that you both have taken the audience through today. They've learned so much. So Stephanie, before we end, tell us about your digital, what you're doing in the digital side to give customers more options now that COVID is here.
Yes. So as I mentioned, and through our website, which is pelvicpainrehab.com, we have digital appointments available to anybody who is interested in speaking with us. And again, to go back to the size of our company and the talented staff that we have, so many of our team members have different areas of expertise. So for example, Karah is available for online yoga, Pilates, as well as pelvic floor discussion, where obviously that is not something I can provide. Some of us, and it's listed on our website, have more expertise in pain syndromes. A few of us have more expertise in the postpartum period. And in addition to that, we also have a pelvic floor physical therapist who has completed her integrative health and nutrition degree. So she's able to order online hormone testing and stool tests and can do meal and diet planning for people no matter what they have going on. And so it's really been a cool thing to do over the last 6 months. We literally have spoken to people from around the world. And it's also led us to realize that sometimes we're repeating ourselves a lot. And some of the things that Karah just showed, or that I'm talking about today, can also be packaged into online modules for patients if they don't want to do a one-on-one with us. So we're going to have the most basic level of the programs for the patients that they can do online. And then if that's not sufficient, maybe they see us digitally. If that's still not sufficient, we're also available in our clinics and are well connected to the community and can often refer patients that we're talking to in other states to trusted colleagues. We've been teaching since 2007, so we know a lot of people and can usually help direct patients to where they need to go to get the help they need.
Oh my gosh, I feel so lucky to know you personally. You both have magic hands, and keep doing the amazing work. I think it's just, pelvic health needs to be more and more on the radar of every woman. So thank you for sharing your time, and thank you for sharing your energy and your information and your knowledge. And Karah, thank you for doing the demo. So grateful.
Thank you, Karen.
Thank you for doing this.
You're welcome. All right, I'll see you guys soon.